Hello and welcome, everyone. I can see participants are joining the chat, so welcome. Thank you for joining our monthly Hunger, Nutrition, and Health Action Collaborative webinar. I'm Rachel Forensic with the CDC Foundation. I'm joining you today from beautiful, sunny Denver, Colorado. I would love it as folks are joining and we're getting started if you would please put your name in the chat, and if you'd like to put your organization or where you're coming from today, we'd love to see that. And again, welcome. So the Zoom chat is open. We're going to keep it open for a little while, but once we start the question and answer with our panel, we will close that so it's not distracting, but then we'll open it up towards the end when we ask them audience questions. So please feel free to, in addition to introducing yourself, please also feel free to share any resources that you might have that come up that you feel like would be interesting information as a part of this panel. So feel free to do that. I always appreciate, I say this, but you always follow through to please not put anything political in the commentary or sell any kind of products. So everybody is always really great about that, but it always feels good to just remind you. At any time during the webinar, you can ask any questions, and please use the Q&A feature for that piece. We are recording this, and we will email the recording of today's session to everyone who registered. And you can also view it on our website at impacthunger.org. So we are going to start like we always do with a quick Zoom poll. And we'd just like to find out who is being represented today, what kind of organization or industry you represent. So Lexi, if you could roll that, that would be wonderful. And we'll give folks just, 20 seconds to go ahead and put in your type of organization. If you're just joining us, we're putting into the poll what type of organization that you represent. All right, Lexi, I think you can close that for us. All right, great. We have national nonprofits. We don't have any real local community-based organizations joining us today. So far, they might. And a handful of you from the academic and university sector. So thanks to everyone who is joining us today. We'll go ahead and close that. And all right, now it is my pleasure to turn the show over to my colleague, Diane Kolbach, who is going to be running the webinar for us today. Diane?
Thanks, Rachel. It's wonderful to be with all of you today. Thank you for joining us. Today's topic is breastfeeding and how public health can support breastfeeding. We know that breastfeeding is one of the most evidence-based strategies we have to support health and well-being of infants, mothers, and families. Yet, despite decades of investment and growing awareness of its benefits, many families continue to face barriers to meeting their breastfeeding goals. Those barriers are rarely the result of individual choice alone. They're often shaped by healthcare systems, workplace policies, community environments, access to lactation support, and broader social and economic conditions. Over the past several years, we've seen significant progress through federal investments, state-level innovation, and local partnerships that are creating more supportive environments for breastfeeding and lactation. At the same time, there's growing recognition that improving breastfeeding outcomes requires more than education, or just clinical interventions. It really requires coordinated action across sectors, including public health, healthcare, employers, community organizations, philanthropy, and policymakers. So through today's fireside chat, we'll explore how federal, state, and local efforts are working together to advance breastfeeding support. We'll hear about lessons that are emerging from the field and where the greatest opportunities lie moving forward. I'm delighted to be joined by two leaders whose work spans both policy and implementation. Together, they bring perspectives from the national and state levels on what it takes to move from good intentions to sustainable systems change. The first speaker we have is Sanaa Akbarali. Sanaa currently serves as the Senior Director of Maternal and Child Health at ASTHO, which is the Association of State and Territorial Health Officials, where she leads a diverse portfolio of initiatives to advance maternal and child health policy nationwide. She partners closely with state and territorial health agencies to provide strategic guidance and technical assistance that supports the development and implementation of evidence-based policies and programs. Sanaa's work spans multi-state initiatives and learning communities with a focus on translating research into actionable policy solutions across such areas as perinatal behavior, perinatal health, early life nutrition, contraception access, adolescent health, and risk-appropriate care. Sanaa holds an MPH from George Washington University. And so she is our national perspective, and then we like to bring in a local perspective as well. Our local perspective is coming from Erin Van Denburgh. Erin's a program administrator at the New York State Department of Health within the Bureau of Community Chronic Disease Prevention. Erin holds a Master of Science in Organization Management from Sage College in Albany, New York, and in her role, Erin supports public health initiatives across the state, focusing on promoting equitable access to maternal and child health resources. And I'll share with you that as we were preparing for today's webinar, I learned so much from both Erin and Sanaa about this topic, so I think that you're all in for a treat with them. So thanks for joining us. We're going to start with Erin. Tell us a little bit about your work at the New York State Department of Health and specifically about the Breastfeeding, Chest Feeding, and Lactation Friendly New York BFFNY initiative that you work on.
Yes. Hi, everyone. Thank you very much for having me today. As Diane said, I'm Erin Van Denburgh. I'm from the New York State Department of Health, and more specifically, I come from the Bureau of Community Chronic Disease Prevention. And within that unit, we have our BFFNY. We love acronyms at New York State DOH, our Breastfeeding, Chest Feeding, and Lactation Friendly New York, which is actually a grant. It's a competitive RFA that establishes and supports community as places where it's easier to start and continue breastfeeding and chest feeding. We have 9 grantees that we fund that work within priority communities that engage a variety of partners, decision makers, and develop and execute plans to achieve continuity of care for breastfeeding and chest feeding parents. Our New York State Department of Health defines 5 regions within New York State. So we have our Western, Central, Capital, Metropolitan area in New York City that have identified eligible communities in these regions that are racially and ethnically diverse communities within high needs areas. Within the grant BFFNY, we have specific established goals that grantees are working on, and those include supporting breastfeeding and chest feeding and lactation in healthcare practices, work sites, and public spaces through policy and environmental changes. We also have grantees focus on developing breastfeeding, chest feeding, and lactation support groups and coalitions. And the grantees are also working on implementing communication activities.
That's fantastic, Erin. Thanks for sharing that. And in case folks aren't familiar with the geography of New York State, tell us a little bit about that.
Sure. So Western region, if you're looking at the state of New York, Western region is really kind of by the Canadian border in by Buffalo, Niagara Falls. That's kind of our western region. Our capital district is actually Albany, and then also too, we have a grantee up in Clinton County, which if I'm trying to think of a larger city that may be familiar to everyone, I would say probably like Lake Placid. That's like our northern part of New York State. Our metropolitan area, our grantees are Orange County, so kind of like southern from the capital region. And then, of course, New York City is New York City. I'm sure everyone knows where that is.
So those are a lot of different environments that you're working in on policy and environmental change. What have, over the course of the years that BFFNY has been going, what have you learned about the difference between creating breastfeeding supportive policies in those environments and actually changing experiences for families on the ground?
Yeah, so something that we like to focus at New York State Department of Health is acknowledging that rural areas have different needs than the more city areas. So we try to focus our technical assistance that we provide to our grantees based off the specific needs that grantees are experiencing within their communities. So for example, if we look at support groups, something in more rural areas that can be problematic for attendance for participants for a support group is sometimes transportation. So we try to be creative when we're working with grantees to identify solutions to specific needs of grantees, such as transportation in rural areas. So one thing that a lot of our grantees have kind of tried to pivot to are virtual options for lactation support group attendance. Of course, in person sometimes for lactation support is better, but we like to think that having that virtual option, especially when transportation or in-person attendance could be a problematic for an attendee, is a nice option to offer.
That's great. And give us an example of, so that was an example of a rural solution. What's a different type of solution, either suburban or urban, to some of the challenges that you've learned about?
I'm trying to think of more specific needs for urban areas. Every grantee is very unique. I think our city grantees, we have Jamaica Hospital, that is one of our grantees. They are a hospital system, which I think is a unique, can be a unique situation. I don't want to say a challenge. But each grantee, like I said, has very unique needs and maybe obstacles that they are facing to implementing some of our work. But I would say for some of our more larger grantees, the system that they are working in sometimes can be a little bit more, I don't want to say problematic, but maybe a little bit more involved. If that
more perhaps more stakeholders to get on board.
Yes,
in order to
yes,
roll
exactly.
things out.
Yes.
That makes a lot of sense. And through this webinar series, we really like cultivating connections. We really like to focus on partnerships. And it sounds like the New York State Department of Health is a very active hands-on partner to your grantees. But what does it look like on the ground for the grantees? What types of organizations are the grantees, and how do they make sure that they're not just working in a silo?
Yeah, so for the breastfeeding, chest feeding work that we have, it's so important to not be siloed. So we are awarding grantees out in the communities, and those grantees are identifying their specific partners that can help them achieve and implement this work. So for example, we have 6 strategies that our grantees are working on. So some of those partners that you mentioned are our healthcare practices. So grantees are going out into their community and looking for healthcare partners, which are primarily FQHCs, OBGYNs, pediatric offices that are really very involved in breastfeeding and chest feeding with families. They're identifying those offices, and they are helping them to develop not only policies to support families in their breastfeeding and chest feeding journey, but also to helping them become designated by our New York State breastfeeding, chest feeding, and lactation-friendly designation program. It is on our website if anyone is interested in learning more. That is fully implementing our New York State 10 steps. So in addition to healthcare practices, grantees are also going out into their communities and identifying work sites that they can help develop those policies that are supporting employees that are returning back to work. They're also working out in community spaces. So they're going out to their libraries, maybe a sports venue where the public is going out and they want to be able to breastfeed, chest feed, pump. How can they support those areas? So they're really not working in silos. They're looking for partners. So healthcare practices, employers, coalitions are huge because those are all the partners that you want to have involved to support breastfeeding and chest feeding parents. Community spaces, as I mentioned, and they're also working with decision makers to highlight successes that they are achieving and getting out the word about how important breastfeeding is, educating them.
Mm-hmm. That's fantastic. And you mentioned you mentioned the certification. What does it mean to be a lactation-friendly workplace, for example?
So work sites, the grantees actually develop their own worksite recognition program. So they develop the criteria that when they go out to do an assessment of an employer, what criteria do they want to see in order to designate them? So a lot of that will look like making sure that there is a private space that is not a bathroom for someone to pump, access to running water, power, things like that. So the grantees are developing their own criteria for the work sites. And they're going out doing assessments, providing technical assistance. They can even go as far as purchasing some things to support the development of lactation spaces. And then on the flip side, for the healthcare practices, we at New York State Department of Health, we have a designation program that we manage, and that is fully implementing those 10 steps. So making sure that you are providing training to your staff, not just your healthcare providers, but your front desk staff. Do they know how to support, patients that are coming in that are looking to breastfeed or chest feed in the waiting room? Having an office policy, we help them develop that. Training, so we have a few different designations: the community spaces, the work site, and the healthcare practices.
That's fantastic. And as we are going through this, I see we have someone from Georgia Span who mentioned that Deborah mentioned that they have a regional breastfeeding coalition toolkit. And Deborah, I'll encourage you to drop that in the chat for everyone if you'd like to, or connect with me after the webinar and I can send that out to everyone. But feel free for our attendees, if you have questions, put them in the Q&A, or you put them in the chat, or if you have resources that you'd like to share, feel free to do so. So we're waiting a few minutes on Sanaa. She should be here soon, but in the meantime, this is so interesting, Erin. When we were preparing for the webinar, you mentioned you have a mission to normalize breastfeeding. Can you tell us a little bit about what that means to you?
Yeah, sure. So I think I shared a little bit of my personal experience where growing up in, Albany, New York, I wasn't really exposed to a ton of breastfeeding, not only in like health education in schools, but also too, I think, out in the community. So I really fully appreciate that New York State BFFNY really focuses on normalizing and supporting breastfeeding. And that is supporting breastfeeding where parents are working. So as I mentioned, working with employers to support parents who are breastfeeding and chest feeding, where they play, out in the community spaces, and live. So really, ideally, supporting a parent wherever they go throughout their day. They are fully supported in their breastfeeding or chest feeding journey.
That's amazing. I'm sure that resonates with a lot of people on the call today. And Deborah, thank you. I see you dropped the link for your toolkit. Everyone will include links and resources when we send out the follow-up email. So thank you.
And I see Deborah's from Chautauqua. So hi, Deborah.
Great. Erin, thank you for that. I'm going to turn to Sanaa now and ask her a couple of questions, and then we'll come back and the three of us will talk together. Then we'll open it up for Q&A with participants. Thank you for sharing your work with us. Sanaa, welcome.
Hi, can you hear me?
I can hear you. Yes.
Okay, fantastic.
Thank you for joining us today. Tell us a little bit about your work at ASTHO, the breastfeeding learning community, and why public health should really care about breastfeeding as a public health issue and not just a matter of personal choice.
Yeah, so the ASTHO, I'll start with the ASTHO breastfeeding learning community. So the ASTHO breastfeeding learning community was a CDC funded initiative, and it was really designed to support state health agencies in advancing evidence-based breastfeeding policies and practices. And through funding from CDC's Division of Nutrition, Physical Activity, and Obesity, or DMPAO, we at ASTHO worked with 16 of the SPAN recipients, so the state physical activity and nutrition states, to really strengthen breastfeeding support across their jurisdictions. And the learning community was focused on three key areas that research shows can really improve breastfeeding outcomes. And that includes maternity care practices within birthing facilities, strengthening continuity of care, and community-based breastfeeding support after families leave the hospital, and then supporting compliance with the workplace lactation accommodation requirements so that parents can continue to breastfeed after returning to work. And I apologize, I am at the Amtrak station, so I don't know if you can hear. Okay. So beyond technical assistance and peer learning, ASTHO also invested in state-led innovation. So in 2022, 5 states, Colorado, Illinois, New York, Pennsylvania, and Utah, received innovation funding to really sustain, expand, and launch some of their community engaged initiatives that were aimed at advancing breastfeeding equity. And those states also participated in a breastfeeding policy academy that ASTHO hosted, where they engaged in virtual learning sessions with national experts, received tailored policy and programmatic support, and learned from one another through peer networking. And each state ultimately developed and presented a policy project that could be applied within their jurisdiction. And while ASTHO is no longer funded to convene the breastfeeding learning community, we still see its impact through policies, partnerships, and systems changes that states implemented as a result of their work. And I'd say one of the biggest lessons we learned from the learning community was that sustainable breastfeeding support requires coordination across healthcare systems, public health agencies, employers, and community organizations. And many states we see continue to build on those relationships today. And then to answer the second part of your question, I think one of the most important things to understand is that breastfeeding is not simply an individual choice. It's heavily influenced by the systems and environments that surround families. So a person's ability to initiate and continue breastfeeding is shaped by factors like access to paid leave, workplace accommodations, maternity care practices, community support, healthcare access, and economic stability. And when those supports are absent, breastfeeding becomes significantly more difficult, regardless of a person's intentions. So from a hunger, nutrition, and health perspective, I think breastfeeding is really an upstream public health strategy and supports infant nutrition, maternal health, and family well-being. But we can't solely focus on education, right? We also need policies and systems that make breastfeeding possible. So that I think the question isn't just, do parents want to breastfeed? It's, have we created the conditions that allow them to succeed?
That's fantastic. Thank you for that overview and what you're describing with the breastfeeding learning community and the support that ASTHO provides. We heard that from Erin as well, from the New York State example. I wonder, since your work spreads the whole country, you mentioned some of the states that you worked with. What was the most innovative breastfeeding policy or program you've seen emerge from a state or territory in the last few years that you'd love for people to pay more attention to?
Yeah. So I think generally one trend that we saw among states that I'm particularly excited about is the integration of breastfeeding support into broader systems of care, especially through partnerships between healthcare providers, public health agencies, and of course, community-based organizations. So for example, we saw several states work to strengthen continuity of care by creating referral pathways that connect families from hospitals to community lactation support, peer counselors, doulas, and home visiting programs. So rather than viewing breastfeeding support as sort of like this single clinical encounter, they're building a coordinated support system around families. And so in one of the states, the Department of Health actually partnered with the State Breastfeeding Coalition and other community organizations to improve support for breastfeeding families experiencing food insecurity. So specifically, they were engaging partner organizations and community members in implementing systemic changes to increase access to pasteurized human donor milk and skilled lactation support in a food pantry. So they did a scan of food pantries and a survey of food pantry clients. And they trained food pantry staff and ultimately established a pasteurized human donor milk pickup site at the food pantry for wider community distribution by home visiting nurses. So I think the most innovative policies and programs that we should look at are those that really build on strong partnerships and collaboration.
That's fantastic. It's great to hear about initiatives that are really meeting people where they are in the community and where they're going anyway. Making the healthy choice the easy choice, as we like to say in public health. Tell us a little bit about the partnerships that are involved with that, and what makes an initiative successful beyond just having funding for it.
Yeah, I think what makes efforts successful isn't just funding. It's actually that partnership and sustainability. So the strongest programs that we've seen have champions across sectors. They've developed shared goals. And then they also have the infrastructure that helps families navigate services. And I think the most important part is that they're engaging communities directly in designing solutions, which make the programs more responsive and effective over time. So it's really establishing and grounding those relationships and partnerships that I think really lend itself to sustainability and effectiveness of programs.
That's great. We heard that in what Erin shared as well in New York about the workplace-friendly lactation sites, having criteria that's specifically developed by the community who is in that area, and perhaps utilizing that workplace, because as we know, everything looks different depending on where you go. So that's great. I want to remind our audience members you can submit questions through the Q&A for us, and we'll take them at the end. You can also put questions in the chat if you're able to do that. Great. So we do a little poll at the beginning of the webinar where we ask what types of organizations people are from, and it happens in this particular one, we don't have a ton of folks from CBOs. Usually we do have more of a showing from community-based organizations, but since you work with all different kinds of partners, what do you think it's important for people to understand about improving breastfeeding access? What are some ways that you're opening that conversation with partners?
Yeah, that's a great question. I think so. With the breastfeeding learning community, one thing that we really suggested is that state teams bring together multidisciplinary folks across sectors, because breastfeeding is not just it's a public health issue, right? And I think one of the things that we saw through the learning community is that one of the partners that continued to be underengaged and probably should be more engaged were employers in the business community. And so I think, we've made tremendous progress in recognizing the importance of workplace lactation accommodations, but families still face significant challenges when returning to work. Um, and so I think that um, one thing that our breastfeeding learning community did, underengaged, who would needed to be part of the conversation and how to start to have those conversations with those folks and frame breastfeeding in a way that I think they understood and could think about how does this fit into the work that we're doing and how can we really support each other in that.
That's great. Um, so it sounds like you found that the business sector was really underengaged. And I want to ask Erin, does that mirror what you've seen across New York State?
So New York State's a little different, I think, because we do have legislation that protects a parent's right to breastfeed or chest feed when they're returning to work. I will say our grantees sometimes focus on maybe some of the smaller employers to help them implement and fully get like a lactation space, just because I think resource-wise, maybe they don't have as many resources to establish that lactation room as maybe a larger employer would. So I would say we're a little different in that we do have legislation that protects the rights. So employers kind of have to do it, but yeah, I think the majority of our grantees work with kind of some of the smaller employers.
Great. And just following up with you, Sanaa, if you could bring one new partner into the conversation tomorrow, who would that be?
I think it would be our policymakers. We work, at ASTHO, we work with the health officials. And like I mentioned, sort of at the top of my remarks, that breastfeeding isn't sort of this single clinical episode. We need policies and programs that really support families' choices to breastfeed and allow them and give them the infrastructure to be able to do so. And I think with the learning community through our policy academy, we worked with several states to develop and think through, like big P, little p policies to share with their legislators and their policymakers to really maybe change or modify the system so that it was more breastfeeding friendly. So I don't know if it's a new partner, but I think it's a critical partner that we should continue to bring to the table.
That's great. And let me ask you the same question, Erin. If you could bring one new partner or type of new partner into the conversation, who would that be?
We expand on our work and our involvement with decision makers and kind of getting them to back our development of policies so that we can implement those changes in workplaces and expand on protection. So I would say probably expand on our work with decision makers as well.
Mm-hmm. Great. It's nice to see alignment. And next, we're going to talk about kind of attitudes toward breastfeeding promotion or support. Erin, I'm going to throw this question to you. What's one assumption about breastfeeding promotion or support that the field of public health should challenge?
I think we talked a little bit about this already, but I would say one thing is education alone is not enough. We really need those real life supports in order to make sure breastfeeding and chest feeding parents are successful in their journey. And so building those lactation friendly workplaces, normalizing breastfeeding, those are the best ways to fully support breastfeeding. So not just education.
That's great. And we're gonna go down this road a little bit more. If Sanaa, this one's for you. If you had a room full of funders and private sector leaders willing to help, what would you ask them to invest in that government programs alone can't accomplish?
I would encourage investment in community-based infrastructure. I think, government programs play a critical role, of course, but some of the most trusted support comes from community organizations, peer counselors, doulas, local breastfeeding coalitions, and providers who are culturally responsive to the needs of their community and are deeply connected to the families that they serve. And I often think these organizations operate with such limited resources despite having sort of outsized tremendous impact. So I think, philanthropy and private sector investments can provide the flexibility to innovate, to pilot new approaches, build leadership, engage leadership within communities, and sustain programs between grant cycles. So I would say community-based infrastructure, because if we want to see lasting change, we need to invest not only in programs, but also in relationships, trust, and community capacity.
I love that. And so basically talking about investing in the people part, not just the programs,
Exactly.
but the people who are running the
The people.
programs. Yes.
Exactly.
Yes. And Erin, let me ask you the same question. What if you had a room full of funders and private sector leaders willing to help, what's something you'd ask them to invest in that government programs alone can't accomplish?
Them to invest in maybe some lactation education programs. So like more scholarships for those who are interested in pursuing like their CLC certification or their IBCLC certification. I think those are few and far between, those lactation consultants. So I would encourage them to open up some more scholarships, make it more accessible for those to become IBCLCs or CLCs.
Great. And we love acronyms too, but can you spell those out for us just in case anybody doesn't know those acronyms?
Sure. So those are certified lactation consultants. An IBCLC is a little bit higher of a certification, a little bit more involved in achieving that. And then a CLC is a certified lactation consultant.
Thank you. And this has been such a fantastic conversation. We've already got a couple of questions in the queue. We're going to do a lightning round, 3 quick questions for each of you. So first one, quick answer. What's one federal or state resource every audience member should know about? Jump in. Go ahead.
Oh, go ahead, Erin. Go ahead.
No, I was just going to say really quick, one state resource, I would recommend checking out our New York State Department of Health website. We have our breastfeeding, chest feeding, and lactation friendly grant. There's some great information there. We have a lot of great resources. So I would recommend our New York State, I'm a little biased, Department of Health website. And then a larger resource I would recommend is La Leche League. So it's breastfeeding support and education around the world. They have free breastfeeding support meetings, in person and virtual. And they also do have evidence-based guidance and resources that support breastfeeding.
Erin, you took my answer with La Leche League, but I'll also highlight the U.S. Breastfeeding Committee. USBC also has a really wonderful website, several great breastfeeding resources, including existing and active legislation related to breastfeeding. So I would add that as well.
Awesome. And Sanaa, what gives you hope? One thing that gives you hope?
The growing recognition that maternal and infant health outcomes are interconnected, and that we're seeing more organizations from public health to healthcare to nutrition to workforce really coming together around shared goals. I think that collaboration gives me a lot of hope.
Great. And Erin, how about you? What's one thing that gives you hope?
One thing that came to mind when you asked this question was some of the success stories that our BFFNY, our grantees, are sending in to us. I think because it shows us the real impact of that this work is doing in real people's lives. And just a quick example of some of the numbers that we recently had a mid-grant. So we have a 5-year grant. This was our midpoint report. And our work for the reach numbers has reached 475,000 patients through our healthcare work, 31,900 employees with our grantees work in work sites, and then 94 community spaces have been involved in developed policy. And so when you think about that and you see those numbers, you realize that this work is really making an impact in people's lives.
Well, that's fantastic. Congratulations. And last quick question. What's one action attendees could take next month to strengthen breastfeeding support in their own work or their networks?
I think to really ask ourselves, how does breastfeeding fit into the work that we're already doing? So regardless of your background, whether it's maternal health, nutrition, Medicaid, I think there's likely an opportunity to better support breastfeeding through existing programs and partnerships. And I think, sometimes meaningful change really starts with making those connections.
Great. Erin, what's one action attendees could take?
Diane, I know you said one, but I'm just going to do three quick ones. I want to mention that August is breastfeeding month. So that is coming up. And I would encourage you just to do a quick search. If you want to learn more about it, just Google search breastfeeding month, August. And then two other things I just want to mention in ways to do that is share a breastfeeding resource with someone, with your team, like Leche League, which we mentioned before, or do one action that tells families in your communities or workplace that breastfeeding is supported here.
Thank you. That's fantastic. And I mentioned that we already have questions rolling in from the audience. So we are going to turn to that portion of our program. So I will take this. This question is for you, Sanaa. Among the SPAN states you worked with, what state-level breastfeeding policies were successfully implemented? So if you could, I guess, briefly describe any policies that folks were able to pass.
Yeah, so at ASTHO, we don't necessarily, I want to be careful here, don't necessarily advocate for certain policies because we are a nonprofit, government-funded organization. However, I will say one of the more interesting little p policies that we saw that was really successful is the team, one of the health departments used the innovation dollars that we gave them to support 44 work sites with technical assistance, which included training to implement changes to their current policies and working conditions for lactating persons. So prior to this intervention, some of the data that we gathered prior to this intervention, they reported that only 53.5 of the work sites were actually compliant with the federal lactation law. But after these tailored interventions, 74% of the work sites were compliant. And so just being able to work with the work sites, provide the technical assistance they need to become compliant and provide those that support for individuals returning to work, I think was super successful.
That's great. And can you just describe what the difference between small P policy is and big P policy in case people haven't heard that that phrase?
Yeah, sure. So when I think of big P policy, I think of like regulations and legislation, and then little P policy, thinking more about like organizational change or things that don't necessarily require legislation to take place.
Great.
So even changes, in the workplace would be, to me, a little P policy change.
So, and it sounds like ideally you want the big P policies to be working with and backed up by the small P policies.
Yes.
That you really need both.
Ideally, absolutely.
That's great. I have another question. Levelyn Isani, you submitted a question, but it's a little bit confusing. If you can clarify your question, that would be really helpful. This person is a graduate student in medical sociology and is wondering about policies that have made environments better for breastfeeding. So since they're a graduate student, maybe are you aware of any policies at higher learning institutions or other places like that that have been successful in supporting breastfeeding?
Yeah, I think one of the working with universities, one of the areas that we worked with states that were participating in our learning community was around workplace accommodation. And so even things like creating in a private area to pump, having a refrigerator, having a chair, like being able to even provide some of those structural spaces, safe spaces for individuals who are breastfeeding to be able to pump is one of the sort of a little p policy that I think can make a huge change and often it doesn't require a lot of investment. You know,
Yeah.
a lot of our states would use the innovation funding to buy, small refrigerators or create sort of a room or a space that was dedicated to pumping. And so it wasn't just, a conference room that you could sign out and use, but it was an actual dedicated space. And so I think we've also seen that in universities as well for students and professors who are returning to work. I don't know if that helped answer that question.
That I'm hoping, and if Levelyn, if that didn't answer your question, just let us know, and we're happy to take other questions. Do we have any other questions from participants? Let's see. Here is a question that was submitted ahead of time with the registration. What are some ways that community-based programs can support breastfeeding beyond the first 6 months? And I'll ask Erin if you want to take that, or Sanaa, whoever wants to jump in with that.
6 months, I would say maybe promotion, establishing support groups for parents who are looking to breastfeed and chest feed. I think sometimes when you're in the hospital, you get a lot of great lactation care, and that can really fall off very quickly. That support once you are discharged in your home and you're on your own. So I think any promotion that organizations can do that promote baby cafes, support groups, peer lactation counselors, any support that can be offered to a parent once they are discharged from the hospital, I think is the best way to support.
Great.
Yeah, I would ditto that, Erin.
That's great. All right. Well, we don't have very many other questions. Oh, here's one more. What motivates work sites to participate in the New York Grants Program or to become breastfeeding friendly?
Works specifically grantees. So any employer that is in their community that is approached by a BFF&Y grantee, they can offer support to that employer to best support their employees. So sometimes that looks like the grantee providing technical assistance to an employer for developing a policy for supporting their employees. What does their lactation policy look like? Do they need help developing it? Do they have one? Does it need to be updated? So a lot of it is policy work, but also too, as I mentioned, one thing that a grantee can also do is kind of financially support an employer with purchasing some items to create like a lactation room. So for example, we've had grantees who have purchased lactation pods, Mamabas, for spaces for employees so that either, the general public who's coming to their site can use that or employees can use it. So they've purchased lactation pods, they've purchased, comfortable chairs. They've done things that will help an employer develop their office policy, but also to establish that lactation space for employees.
That's fantastic. So your grantees can partner with employers and end up using their grant funds to help make sure that they're able to walk the talk, not just
Absolutely.
change the mindset of people there, but actually have these spaces set up. I love that flexibility that you provide.
Yes.
That's really great. And here's one I'm going to toss over to Sanaa, and this might be our last question unless we get some last minute ones in. Can you share any success stories where breastfeeding support programs were successful in early care and education spaces? Whether it's for, if I know it's off the top of your head, so you can also get back to us because that's pretty specific, but anything come to mind?
Yeah, actually, it's funny that you asked that. I pulled up our breastfeeding evaluation report, so I had some state successes on hand. And we worked with Arkansas as one of our states, specifically the University of Arkansas um, Medical Sciences Center. And so UAMS worked to improve breastfeeding policies in early childhood education centers and family medicine clinics serving breastfeeding mothers and infants in the Mississippi Delta region. So they recruited ECE centers in family medicine clinics in medically underserved counties with low medium incomes to complete assessments of policies and practices. And then they provided training in supportive breastfeeding policies and practices to 9 of the ECE centers and one family medicine clinic. So that was certainly one of the successes we saw as it relates to early childhood education centers and sort of bringing them in and working with them around training related to supportive breastfeeding policies. I'll go back and see if I can also send some more like state examples and resources, but that's the one that was sort of top of mind.
That's great. Thank you. And thanks for the offer of sharing more state-specific resources. I know we will share out information about the work in New York State, but we would love to include other states as you have that information available. That's great. So Lexi on our team, I'm going to ask you to open up the chat. And then from our audience, is there one thing you're going to do this week because of something you learned today? Do you want to take up Sanaa and Erin's calls to action to strengthen breastfeeding support in your own work? If you have any thoughts about that and you want to put in the chat, let us know how you might take this information back into your work. It's great for us to hear about that. And I also want to let everyone know that our next webinar will be on August 19th. And if you go to impacthunger.org, you can register for it there. We have a survey that will pop up as soon as this webinar is over. We read each and every response. I personally read each and every response to that survey. So I really appreciate if you can take a minute or two and just let us know about your experience. It really helps us inform future sessions. Like we ended up going longer. We're trying to be more interactive, and all of that comes from the rich feedback that we receive from participants. So I want to thank everybody who's a frequent participant on these. We really do listen to what you tell us. So I mentioned August 19th. That is our next webinar. I want to thank Erin and Sanaa. You've been fantastic speakers today. I've learned a lot about how public health can support breastfeeding and what policy and systems change really looks like beyond just thinking about the clinical part of breastfeeding. And I appreciate that so much. We will share resources with everybody along with a recording of this that'll be on YouTube. We'll give you the link to it. And if you want to get in touch with us or have any questions for us, you can always reach out to our team in the interim. We're always happy to hear from people if you want to be connected, if you're looking for resources. We love to hear from people. So thanks again for joining us for today's discussion. I hope to see all of you in August, and thank you to our webinar team, and kudos to our great panelists. All right, have a
Thank
great day,
you.
everyone. Thank you.